Have you tried medications, injections, and therapy for your C5 and C6 disc bulge, but the pain is still there? Now, I get it. It can be very frustrating, and you may still be dealing with the constant neck pain, pain down your arms, numbness in your fingers, or even weakness with your grip. After 22 years working with cervical disc injuries, I have seen this exact pattern over and over. I have also seen what changes when the disc is finally treated the right way. In this video, I'm going to walk you through our 6-step non-surgical process we use to treat a C5-C6 disc bulge and why spinal decompression therapy is a key part of reducing pressure on the disc. And be sure to watch until the end because I'm also going to share a story of one of my patients, a nurse with a C5-C6 disc protrusion who had constant numbness in her index finger and was worried about her ability to continue to work until she went through this exact treatment and turned it around completely. Hi, I'm Dr. Tam Lee, chiropractor here in San Jose, California. I have seen too many people wait too long to get the right help or rely on medications just to get through the day. Now, over time, that pain starts to limit how they move, how they work, and how they live. Now, I created this channel for people dealing with neck pain, back pain, disc injuries, or sciatica who are tired of temporary fixes and want to understand what is actually causing their pain. Here, you're gonna learn safe, non-surgical, science-based ways to reduce pain, restore movement, and get back to doing the things that your condition has been holding you back from. Subscribe if you want clear answers, real results, and the confidence to move without constantly worrying about your pain. I post a new video every week. Before I outline our 6-step process for treating a C5-C6 disc bulge using spinal decompression therapy, let me first explain what a C5-C6 disc bulge actually is and why it creates the symptoms that you are feeling. At a C5-C6 level, the disc sits between two vertebrae in the middle of your neck and it acts like a cushion. When the disc bulges or herniates, it can put pressure on the nearby spinal nerve. Now, this is what drives most of your pain. You may feel constant neck pain that is stiff, sharp, and does not fully go away. You may have pain that maybe radiates from your neck into your shoulder, down your arm, and into your hands and fingers. You may notice numbness or tingling that you can't shake off, or maybe weakness in your arm and grip strength where you start dropping things. This type of nerve compression is what we call radiculopathy, and it follows a very specific pattern. Once you understand the pattern, it becomes much clearer why your symptoms feel the way they do and what actually needs to be treated. The problem is most people never get to that point. Most people with a C5-C6 disc bulge, they've already tried medications, injections, and physical therapy, but the pain keeps coming back. That is where frustration can really start. You may get temporary relief, but it doesn't last long. The neck pain just keeps coming back. The pain down your arm returns, or the numbness and tingling in your fingers never fully go away. In some cases, it may even get worse over time. This is also where daily life becomes more difficult. Sitting at a desk or working on a computer starts to aggravate your symptoms. Just driving and turning your head can trigger pain. Looking down at your phone makes it worse, or even sleep becomes disrupted because you cannot find a comfortable position. The reason this keeps happening is because most treatments are not addressing the actual source of your problem. Medications can reduce inflammation, injections may calm the nerve temporarily, and exercise can help with movement, but if the disc at the C5-C6 is still putting pressure on the nerve, the symptoms will continue to return. So instead of just managing the pain, focus has to be on shifting to actually treating the disc and reducing pressure on the nerve. And to do that the right way, there is a specific 6-step non-surgical process we follow where spinal decompression plays a key role. Each step builds on the one before it, and the sequence is what allows us to reduce pressure on the nerve and create lasting results. Step 1 is a detailed consultation and full case review. We go through your history, when your symptoms started, and what may have caused it. We also review your MRI reports and any other specialist findings. This gives us a clear understanding of your condition and helps us set realistic expectations for your recovery. Step 2 is a full physical and neurological examination. We test your movement, we look at your muscles and your nerves to identify which levels are involved and how the nerve is being affected. Now, this helps us confirm whether the C5-C6 disc is the main source of your symptoms. Step 3 is taking spinal x-rays. Even if you've already had an MRI, x-rays show us your spinal alignment, any shifting or rotation, and signs of instability. We take them standing so that we can see how gravity affects your posture and structure. Now, this is important because it gives us information we cannot always get from an MRI. And if you have not had an MRI yet, we may still refer you for one to confirm the disc issue. Step 4, non-surgical spinal decompression therapy, which is a key part of the process. Most people have heard of spinal decompression for their lower back, but not for their neck. The cervical spine can be treated just as effectively using a specialized decompression table that we apply a gentle controlled traction to your neck to reduce the pressure inside the disc. Now, this helps the disc bulge begin to reabsorb and take pressure off the nerve. As that pressure decreases, this is where your symptoms start to change. The pain that travels down your arm begins to reduce. Numbness and tingling in your fingers can start to improve. Strength begins to return. This is also where we look for centralization, where symptoms move out of the arm and back towards the neck, which is a sign that the nerve is finally calming down. The treatment is safe, controlled, and specific to your condition. It is not aggressive, and it is designed to work with your body, not against it. Step 5, chiropractic care, combined with targeted exercise and rehabilitation. Once the pressure on the nerve is reduced, we focus on restoring movement, improving stability, and strengthening the muscles that support your spine so that the results hold. Step 6 is nutrition and dietary changes. To help reduce inflammation in the body and support healing in the disc and surrounding tissues, this plays an important role in long-term recovery and reducing flare-ups. When these steps are followed in the right order, it creates a complete approach that addresses the disc, the nerve, and the underlying factors that led to the problem. And once you see how this process works, the next step is understanding whether you are a good candidate for this type of treatment, especially spinal decompression. Spinal decompression therapy is a key part of this 6-step process. Since it's not offered or even discussed by many providers, it is important to understand who it is for and who it is not for. Spinal decompression is most effective when your symptoms are coming from a disc problem that is putting pressure on a nerve. This includes a C5-C6 disc bulge or herniation that matches what you are feeling, like neck pain, radiating down the arm, numbness or tingling in the fingers, or weakness in your grip. It is especially helpful for people who have already tried medications, injections, physical therapy, but are still dealing with ongoing symptoms because pressure on the nerve has not been properly reduced. At the same time, it is not for everyone. If there is spinal instability, severe disc degeneration with very, very little disc height left, fractures, tumors, or infections, or certain advanced neurological conditions, that spinal decompression may not be appropriate. Now, this is why proper evaluation matters. When spinal decompression is used on the right type of cases, it can be very effective and safe to reduce pressure on the nerve and improve your symptoms. And when it is part of a structured process like this, that is when we tend to see the best outcomes. Here's a case study. Nurse practitioner with a C5-C6 disc protrusion. Take my patient, for example, a nurse who came in with a C5-C6 disc protrusion on MRI. She had constant numbness and tingling in her index finger. It was not something that, came and went. She felt it all the time. She literally could not shake it off. And it was starting to affect her ability to take care of her patients. She already tried multiple treatments, cortisone injections, massage, home stretching, physical therapy, and was just taking ibuprofen daily just to try to cope with the pain. But instead of improving, her symptoms were actually getting worse. So being a nurse, she was skeptical. She had never heard of spinal decompression therapy, and none of her doctors had ever mentioned it. At this point, she was worried that this would not get better and could impact her ability to continue caring for her patients. She went through this exact 6-step process, including spinal decompression therapy in our office, physiotherapy, chiropractic care, home exercise, over a period of 8 weeks for a total of 15 sessions. Now, by the end of her care, she reported a full return of sensation. No more pain, no more numbness, and she felt normal again. She was extremely grateful because she thought she would have to live with this forever. If you have a C5-C6 disc bulge and have been suffering with constant neck pain, pain down your arms, numbness or weakness, and the treatments that you have tried failed to give you lasting relief, I want you to know, it's not your fault. As you can see, a comprehensive approach is required to properly treat a disc and reduce the pressure on the nerve. And that is what this 6-step process offers. Now, the goal of this video was to show you what may be causing symptoms and how a structured, non-surgical approach, including spinal decompression therapy, can help address them. Now, I want you to look for a chiropractor in your area that offers a full approach like this, especially spinal decompression therapy. It could be the missing piece that you've been looking for. If you found value in this video and learned something new, like and share it so others can benefit from it too. And if you have any questions, go ahead, leave them in the comments below. I do my best to respond as quick as possible. Subscribe if you want clear answers, real results, and the confidence to move without constantly worrying about pain. And if you are looking for something that you can start right away, watch this video where I show you 5 exercises to help relieve a pinched nerve in your neck, especially at the C5-C6 level.